Mr. President, I know many senators have been back home in the last number of weeks talking and listening to their constituents about things that are on their minds. I was also at home. I heard, as a doctor as well as a U.S. Senator, I heard from many people in my home state of Wyoming who have lots of concerns about the health care law and the devastating side effects that the law has on them. The past few weeks there have been headlines just about every day all across the country with bad news about the health care law and its impact on the American people. And just this morning, Mr. President, the local newspaper, The Hill, has a headline, "Support for Obamacare continues to fall." It says public approval of Obamacare continued to sink this summer, issuing the latest warning for vulnerable Democrats who will face voters this fall after backing the law. It says just 35% of voters now support the health care law. And this is a monthly poll done by the Kaiser Health Foundation. It was released yesterday. It says health care remains one of the most important issues in midterm elections, ranking only behind the economy and jobs as voters' top issues. I talk about health care repeatedly, Mr. President, because I'm a physician, taking care of patients for 25 years, my home state of Wyoming, taking care of families from all around the state, and they come to me with their concerns about the health care law. Now, President Obama says that Democrats who voted for the law should, as he said, quote, forcefully defend and be proud of the law. Is the president proud of the ways that families across America are suffering because of his health care law and the dangerous side effects that people continue to face? Now, here's a headline last Friday, September 5th, front page of the Wall Street Journal, "Hacker breaches part of federal health site." Hacker. Computer hacker breaching the federal health site. The article says a hacker broke into part of the healthcare.gov website in July, uploaded malicious software according to federal officials. So the administration now admits it. It goes on to say the break-in, quote, raised concerns among federal officials because of how easily the intruder gained access and how much damage could have occurred. This is something the Republicans have warned about for a long time. The administration, the Obama administration, didn't do the basic things that any business in America would have done to protect people and their personal information. According to this report, part of the problem in this case was that the website's developers never, and taxpayers have paid plenty to these developers, that they never bothered to change a default password for the system. I mean, you can't believe it. Hackers didn't have to go around some complicated security system or break in through a back door. Oh no, the Obama administration official admitted to the Wall Street Journal that there was a door left open. A door left open. The Obama administration said that so far the hackers haven't stolen anybody's personal information that they know of. Apparently they didn't know about this breach for weeks. The hacker walked in through an open door in July, and the Obama administration didn't know anything about it until August 25th. Healthcare.gov stores huge amounts of personal information, private information about people, about their access information, about their health care information, and people have a right to know that the information is secure. Where are the Democrats on the floor of the United States Senate today ready to forcefully defend leaving a door open for these hackers? Here's another headline on September 2nd. New York Times says, bracing for new challenges in year 2 of the health care law. We all remember how terrible the launch of the health care program was last fall. Remember, right after the president sat down with Bill Clinton, he said, oh, easier to use than Amazon, cheaper than your cell phone bill, you can keep your doctor. America knows that those things weren't true. So we all remember this terrible launch last October. Well, the new head of the government exchange talked about what he expects it to be like this year, year 2. They've had a full year now to get ready and fix the problems, and this Obama administration official just recently told the New York Times, he says, quote, in some respects, it's going to be more complicated. He said, part of me thinks that this year is going to make last year, he said, look like the good old days. America's not ready to go back to the Obamacare website, good old days. That's what the Obama administration's person in charge of the health care exchange told the New York Times. Are the Democrats going to come to the floor and forcefully defend this kind of chaos and confusion with the health care enrollment for a second year in a row? It's another disgraceful side effect of the president's unworkable, unmanageable health care law. I'll give just one more example of what the American people are learning about how the health care law is harming them individually. Insurance companies have been releasing their preliminary rates for 2015, and in many places, for many people, premiums are going up. According to the consulting group PricewaterhouseCoopers, premiums are going up about 8% on average across the country. It's not what Democrats promised when they wrote the health care law. Democrats in Washington, here in the Senate, promised the rates would go down. President Obama went around the country, and he said that people would see their health care costs go down by an average of $2,500 per family per year. Nancy Pelosi went on Meet the Press. She said rates will go down for everyone. That hasn't happened. Premiums have gone up, co-pays are up, deductibles have gone up, out-of-pocket costs have gone up for millions of Americans. As chairman of the Republican Policy Committee, one of the things I do is look around the country and try to find out how the policies that come out of Washington affect people all across the country. I've traveled over the past month and heard from many people that the president's health care law is hurting them individually and costing them more. One place people are really being hurt by the health care law is Alaska. Here's a headline from the Hill newspaper on Monday. Quote, Alaska insurance rates to spike. According to the article, Alaskans buying health insurance through the state's exchange can expect a price spike of more than 30% on average. Another place being hit is Iowa. PricewaterhouseCoopers says the average person in Iowa who buys health insurance through the exchange is going to pay 11.5% more next year in premiums. For others, premiums will be as high as 14% higher. Those Iowa families aren't getting the cut of $2,500 like the Democrats promised, the Democrats who voted for this health care law, like the president said. What they're getting is an increase instead of 14%, more money out of their pockets. You can go round and round for individuals. They are paying more, and it's no surprise then that today the Hill, the headlines is that it is more unpopular now, continues to lose popularity. And then the impact, I mean, it is astonishing, Mr. President, because picked up today's Investor's Business Daily, Obamacare spurs college blues for working students. A lot of students have to work their way through college. Page 1, above the fold, Obamacare goes to college. More than 200 colleges and universities. This is because of the law, the way they define part-time work and full-time work. Full-time defined as 30 hours. Obamacare goes to college. More than 200 colleges and universities have restricted work hours for students, for part-time faculty, or both, citing the costs of complying with the employer mandate related to the president's health care law. So, Mr. President,
the Republicans' time has expired.
I ask unanimous consent for one additional minute.
Without objection.
Thank you, Mr. President. So, Mr. President, what I do is come to the floor to talk about the concerns I have for Americans who are concerned about their jobs, concerned about the economy, concerned about their opportunity to get the care they need from a doctor they choose at lower cost. They see all of these things as troublesome under the president's health care law. So I'm going to continue to talk about this and the impact this has on the American family. I'm going to talk about restoring people's freedom to buy insurance that works for them and their families because they know what's best for them, not the Obama administration. I'm going to talk about reforms that get people the care they need from a doctor they choose at lower costs. I'm going to talk about giving people choices, not Washington mandates. Republicans are going to keep offering real solutions for better health care without all of these tragic side effects. Thank you, Mr. President. I yield the floor.